So my name is Christos Proukakis. I'm what I would call a clinical academic neurologist. So I'm a doctor and I see patients with neurological illnesses, and I also do research and teaching in the field of neurology and neuroscience, and my time is spent approximately doing half of each of these things, which I believe is a very important combination, because in a way, although they're very separate things, one is complementary to the other for many respects, I think. The main interest I have is Parkinson's disease, which is a very common illness of the nervous system, of the brain mainly. And in relation to that, I'm interested particularly in genes and genetics. So my biggest interest, therefore, is where genetics and Parkinson's disease cross over in a sense, and whether genetics can help us understand or teach us anything about Parkinson's disease. So my big research question will therefore relate to Parkinson's disease, because although it's very common and a very disabling condition and progressive and becoming commoner as people live longer, we don't know what causes it. We know in some respect because we know that a particular protein accumulates in the brain and damages it, but we don't know why that happens. So my big research question is, why does that happen? This is a question which many dozens, if not hundreds of people perhaps in the world are trying to address. So obviously my own angle is quite specific and relates to the possibility that we might have mutations in the genes in our brain that we acquire during development. So the question therefore can be restated as, is it possible that mutations in genes which might give Parkinson's disease would happen in your brain only, and therefore to find them you would have to look for them in the brain only? So what I would like to say I found is a smoking gun, a mutation in everybody's brain that causes Parkinson's. I can't say I found that. I think we have to accept that research is a long, sort of hard road, and you don't find something, the first time you look for it, although almost in passing, almost by chance, I did discover a mutation that had not been discovered before that causes Parkinson's, which was pretty significant in its own right. But what we have found is hints that there may be some differences in DNA in the brain, which others have reported on similar on this question as well to some extent. So my research is adding on to existing knowledge, but it gives us enough enthusiasm, I think, to take it further and just do more detailed analysis of more regions, of more genes, of more brains, to hopefully find what I think is probably there.